Processed snacks that contain monosodium glutamate, MSG, may appear innocuous. Crispy chips, flavored nuts, seasoned crackers, instant ramen, and savory snack mixes. But for individuals with high blood pressure, they represent a hidden and serious threat. MSG is a flavor enhancer widely used to make foods taste more savory and addictive, but its sodium content, combined with its effects on vascular function, can silently aggravate hypertension. The danger is compounded because MSG is often consumed in combination with other high-sodium ingredients, creating a perfect storm for elevated blood pressure and long-term cardiovascular harm. The primary concern lies in sodium. Although MSG contains slightly less sodium per gram than table salt, it still contributes to overall sodium intake, and most processed snacks that include MSG are already high in salt. This combination means that a single serving of MSG-laden snacks can provide a significant portion of the daily recommended sodium limit, and multiple servings easily push intake far beyond safe levels. For someone with hypertension, repeated consumption of these snacks contributes to fluid retention, increased blood volume, and elevated arterial pressure, placing chronic strain on the heart and arteries. Beyond the sodium content, MSG has additional effects that can exacerbate hypertension. Some studies suggest that MSG may increase sympathetic nervous system activity, causing transient spikes in blood pressure. This effect, combined with the already high sodium levels in processed snacks, creates acute episodes of elevated blood pressure that stress the cardiovascular system. Over time, repeated spikes lead to stiffening of arteries, reduced vascular elasticity, and increased workload on the heart. Habitual consumption of MSG-containing snacks therefore accelerates the progression of hypertension and vascular aging. Processed snacks with MSG are also often high in unhealthy fats, particularly trans fats or saturated fats, which compound the problem. These fats promote arterial plaque buildup, systemic inflammation, and endothelial dysfunction. When combined with MSG and excess sodium, the cardiovascular system is exposed to a multi-pronged assault: fluid retention, arterial stiffening, inflammation, and elevated pressure. This creates a long-term risk for left ventricular hypertrophy, heart failure, and increased susceptibility to stroke or myocardial infarction. The habitual nature of consuming these snacks adds to their danger. MSG-laden foods are engineered to be highly palatable and addictive, encouraging repeated consumption throughout the day. People may reach for flavored chips, instant noodles, or snack mixes multiple times without realizing the cumulative sodium and MSG intake. Over weeks, months, and years, this repeated exposure silently accelerates hypertension, stiffens arteries, and increases cardiac workload, often without obvious warning signs. Another concern is the interaction of MSG-containing snacks with other high-sodium or high-sugar foods. Many individuals pair MSG snacks with sodas, fast foods, processed meats, or instant meals, creating a synergistic effect on blood pressure. This combination can produce larger spikes in arterial pressure than any single food alone, contributing to long-term damage to the vascular system, kidneys, and heart. Even occasional indulgence can produce noticeable acute effects, while habitual use compounds the risk exponentially. Processed snacks with MSG also displace healthier foods from the diet. By relying on these convenient, flavorful snacks, individuals often consume fewer fruits, vegetables, whole grains, and other nutrient-rich foods that are protective against hypertension. This imbalance reduces the intake of potassium, magnesium, fiber, and antioxidants, which normally help counteract sodium's effect on blood pressure, further exacerbating the harmful impact of MSG-laden snacks. The cumulative damage of regular MSG snack consumption is insidious. Blood pressure may rise slowly, arteries stiffen, and kidney function may decline over time, all without immediate symptoms. By the time severe hypertension, vascular complications, or cardiovascular events appear, substantial damage may already have occurred. The hidden and addictive nature of these snacks makes them especially dangerous. They provide immediate taste satisfaction but quietly undermine cardiovascular and metabolic health. In conclusion, processed snacks containing monosodium glutamate are far more than a convenient indulgence. They are a hidden, potent threat for people with high blood pressure. Their sodium content, combined with potential effects on sympathetic activity, unhealthy fats, and addictive consumption patterns, produces acute blood pressure spikes and long-term vascular stress. Habitual intake accelerates hypertension, stiffens arteries, increases cardiac workload, and raises the risk of heart attack, stroke, and chronic kidney disease. For hypertensive individuals, MSG-laden snacks are not harmless flavor enhancers. They are a silent, cumulative danger that requires strict limitation or avoidance to protect cardiovascular health.